Hello everyone, my name's Andy Oakley. I'm a businessman, I'm an author, and I guess I'm a bit of an analyst. I like to get to the bottom of how things work, mostly from a zoomed out position. I think I can see patterns better when you zoom right out. I've been working on a book for a year or so now, and part of that book, along with theorizing about many things, is diet. And as the COVID Delta pandemic has played out in front of us, I noticed something that is very important, how diet and the outcomes of COVID are very closely related. So I've gathered a whole lot of data here today and put it on some slides, and I think it'll probably take half an hour or so to get through. So sit back and see if we can all learn something today. Okay, one of the first things that we need to do, I'll just grab a highlighter, is we need to understand or think about evolution in the order in which species occurred on Earth. And as we can see here, that plants evolved before animals, and that animals began to eat the plants. And so you're going to be amazed as time goes by and more books come out, I think, about just what plants are and what they're capable of. Because without a brain, without a laboratory, and without even a Bunsen burner, plants developed a chemical defense mechanism that would affect the animals that ate them. In fact, they worked out that if they could attack the intestine walls of these animals, they could reduce their lives significantly, their lifespans. And so that's something that I'd been studying for a year or so as a result of picking up this book here, The Plant Paradox by Stephen Gundry, which talks about how the plant's defense mechanism affects humans. And he had noticed this. He did his degrees at Yale University, also worked at the Medical College of Georgia. He's a cardiothoracic surgeon, and had performed more than 10,000 operations. He's got specialties in medicine, nutrition. He's also a scientist and a researcher. And so what he had realized doing his operations and seeing the patients was that they were presenting with similar problems. And he realized, and there was one patient in particular that was doing certain things to do with his diet, and he honed in on that. And he's worked this whole thing out. Not just him, there are plenty of other scientists around that are on this as well. And my partner and I read that book, Changed Our Diet, which you'll see what that diet is shortly. And immediately, neither of us are very big people, but I lost about 5 kgs and my partner lost about 6. And our lives have become immeasurably better, and we are immeasurably healthier as well. So this all dovetails into what's going on with COVID quite nicely. And as I carry on, we'll learn some more. So we need to go back, I'll just grab my highlighter again. We need to go back in time to about 9,000 years ago in the Fertile Crescent, which is where at the time Mesopotamia was Egypt. This is the Mediterranean Sea, the Persian Gulf. So this is the Middle East. Now this green area here was known as the Fertile Crescent. And it was a very fertile place for plants to grow. And in this area, the humans noticed that animals were eating a type of plant, cereal grasses, and that these animals, which were mainly pigs, goats, lambs, etc., that they could become domesticated. They became fat and docile, And so this was as a result of eating the plants in this area, which were high protein plants. And here we can see, even on some of the sculptures on the back in the Egyptian days, they're farming. And so farming and agriculture began about 9,000 years ago in this part of the world, the Middle East. And it was really to facilitate the first civilizations. And later those civilizations took the cereal grasses and the domesticatable animals to almost every part of the world. Okay, so let's have a zoom in on some of these plants or food groups. Now, these plants contained in them lectins or gluten, and they're both considered proteins. Gluten is found in wheat, barley and rye, while lectins are a carbohydrate binding protein. They're found in legumes, whole grains, beans, many vegetables, and also in dairy products, mainly in dairy products because those animals are eating those plants. So if we look at these food groups here that contain the plant's defense mechanism, which is lectins or glutens, we see the first group is tomatoes, potatoes, peppers, eggplants, goji berries, and the whole range of nightshade vegetables. So these foods contain the plant's defense mechanism. Also in legumes, including lentils, beans, peanuts, chickpeas, peanuts, peanut oil, and other peanut-based products, grains and flours, and dairy products. So you can see that these foods make up a lot of, and in some cases all of, the Western diet. And as I said earlier, both lectins and glutens damage the very thin walls of our intestines. And once they damage the walls, that allows toxins into our bodies, which can cause major problems to humans and animals that eat them. So I said the plant's mechanism system. So here we see a healthy intestinal barrier where everything is joined together closely, and the food is on one side and the inner of the body is on the other side, the organs and so forth. And here's an example of where the lectins or glutens have broken through the very thin gut wall, allowing toxins into the body. Here's another view of how that works. Okay, so this graphic is, we give a credit to Bruce R. Stevens, a PhD, and he's put together a graphic, I guess, of what actually happens and how important our gut microbiome really is. And what happens when you get this leaky gut, which is what Dr. Gundry has written a lot about, a lot of YouTube videos as well. So some of the things that can happen, I'm going to struggle with some of these words. I'm not that medical, but that doesn't stop me from analysing data. In fact, in some senses, it makes it easier. But my pronunciation might be lacking a little bit, so I apologise about that. So we're talking about the leaky gut, the biogenetic amines, peptides, inflammation, neurotransmitted food, diet, liver, etc. And this causes hypertension, right? And also lowers the immune system, affects the bone marrow, spleen, so the gut microbiome human meta-organism crosstalk. So we see things like depressive hypertension, non-depressive hypertension, non-hypertensive depression. We see inflammation, which is weight gain, impaired sodium balance, blood vessel stiffness, and atherosclerosis. It also affects the central nervous system. This can cause autoimmune systems, and it also affects our mood, psychological stress, the depression networks. So you can see that the bacteria in your guts controls almost everything that about our lives, in fact. Some other issues that the lectins and glutens cause are joint inflammation. All of these things are in my family. Dementia, my father and aunties have had dementia and have passed on with it. Tiredness, bloating, anxiousness. So I've also chucked in here that there's a lot of papers. This isn't all from one man. This is from a huge array of medical people, scientists all around the world. Okay, if we just leave that information about the leaky gut syndrome and look now at a paper that was released by the US government Department of Health from the Centers of Disease Control and Prevention. That's the CDC. It was released in July 2021. This is an interesting data set because it includes 2 winters. And the winter in the US finishes in February, and the data is being collated in March of both 2020 and 2021. And the paper is the underlying medical conditions and severe illness among 540,667 adults hospitalized with COVID-19 between March 2020 and March 2021. There was, we'll see shortly, but about 4.8 million people turned up at the hospital, and this data set is regarding the 540,667 that were hospitalized. So the introduction of the paper is that this is severe COVID-19 illness in adults has been linked to underlying medical conditions. So when they're not just talking about the COVID illness itself, the flu or the cold symptoms that people have, they've identified frequent underlying conditions and their attributable risk of severe COVID-19 illnesses. So they use the data from more than 800 US hospitals in the Premier Healthcare database that were aged 18 years or older. And so I think we'll just leave it at that, and we'll move on to the next. And we will just now ask ourselves the question, why were sick people presenting at hospitals with cold and flu-like symptoms? Why weren't these people being treated early and treated at home? I mean, we're talking about cold and flu symptoms here. So the man in the top right there, Peter McCulloch, MD, he testified to the Texas Senate committee about the reasons for this. Now, he is the top cited doctor in his field in the world. Now, he states that there's a suite of treatments that could have prevented about 80% of the deaths, and we'll see the number of deaths as we move through this presentation. Now, this is the text of his testimony, and if we just highlight a couple of sentences of it, he says, thus urgent pandemic response can be viewed as having 4 pillars as shown on the first chart. Obviously, he had charts with them. The 4 pillars are contagion control, early home treatment, late stage treatment, and vaccination. And to date, we have tragically ignored the second pillar, which is the early treatment. So I'm glad that today's hearing is focused on it, which is what he said. There are YouTube videos with that testimony that you can read. Now, if we remember, and you'll have to excuse my eyes might need to go to the other screen there because my camera is covering up some of the text. But if you recall that politicians and the media, and also many gutless physicians, fought to strike off anyone who was advocating for early treatment. And we're talking about the uses of vitamin C, vitamin D, ivermectin, hydroxychloroquine, or any other suite of medicines are out there, aspirin. There's some steroids, all sorts of things, any number of things that could be used. Any medical intervention prescribed as useful was immediately attacked. And it was politicians and the media that began focusing just on vaccinations. I'm not against vaccinations. I'm just working our way through the pandemic and the various things that played out. And Peter McCulloch, MD, was not the only person saying this. If we look on the screen there, we see that there was the Great Barrington Declaration that had about 800, well, at the moment, as of today when I put the information together, 850,000 signatures. Now, 14,879 medical and public scientists have signed this declaration, 43,804 medical practitioners. And if you actually read the Great Barrington Declaration, and I encourage everybody to do that, it's just information. The more that you should listen to what our governments say, and you should listen to the health professionals, but you should also do your own research, and reading the Great Barrington Declaration will help with that. And you'll see that in there that they do not advocate lockdowns. They say that COVID-19 is less harmful than the flu, and that they say let those not at risk live normally. So there's some very good information there, and we can see that it's not one or two doctors who are speaking up here. It is literally tens of thousands. Okay, so we're going to have a look at we're going into the CDC data now, and we're going to see analyze some of these numbers here. We'll see first of all that 4,899,000 people, 447, showed up to the hospital with flu or cold-like symptoms. And these are the people that couldn't get treatment at home. Apparently there was no treatment for COVID, and they were told to go to the hospital. So of the 4.8 million people, these were the ones that were hospitalized patients with COVID, having tested positive using the PCR test for COVID-19. So there was 540,667 people that were hospitalized. 249,522 of them were admitted to ICU, right? And of that figure, 76,680 got mechanical ventilation. And in the US, many of you will be aware that I'm pretty sure each patient that they mechanically ventilated, a hospital got about $13,000 US for. And of the 540,000, 80,174 died. Okay, so when I just a quick skim over that, 540,000 people go to hospital, are hospitalized, and of them 80,000. So as a treatment, going to hospital and going through ICU and being mechanically ventilated is the most terrible treatment one could imagine. 80,000 of them died. This is a terrible figure. But we need to look a little closer at these figures. It doesn't say that all of the mechanically ventilated people died, but you might assume some of that. I'm not going to. The data is just not there. In fact, there is no data of what the 80,174 died from. It doesn't say that they died of COVID-19. It just said that they died. But let's look at now some of the conditions and comorbidities that these people had, and the death figures of them. So there were, this is the number of comorbidities. Of those who had no comorbidities, there were 461,000 of the 4.8 million. But if we just go down right to the end here and see the death figures, these are otherwise healthy people, right? They don't have any other comorbidities. 740, right? So of the 4.8 million people that showed up to hospital with cold and flu symptoms, 540,000 of them were hospitalized, and only 740 of them died that were healthy people with no comorbidities. Then with one other comorbidity, we'll have a look what those comorbidities are later, a further 2,087, so about 2,800 relatively healthy people died of the 4.8 million people that showed up to hospital. This is staggeringly low numbers, staggeringly low numbers. Then when we move to the next sets, there's 2 to 5 comorbidities, 6 to 10, and more than 10. So these people are relatively unhealthy to very unhealthy people. And you can see that that is where the bulk of the deaths occur, practically all of them, in fact. These are very unhealthy people. So we'll have a look at some data a little bit further on. Okay, some analysis of some of those figures. Of 4.8 million sick people who went to hospital without early treatment, 80,000 of them died having tested positive for COVID-19. That's about 1.67%. I did some analysis looking at some of the hospitalization deaths in the US, and in both the year 2000 and 2010, 2% of all hospitalizations in the US ended in death. So that figure is lower than what you might normally find in hospitals in the US. Of the 4.8 million people sick who were admitted to hospital, only 740 were otherwise healthy and died having tested positive for COVID-19. That's about 0.02%. Of the 4.8 million people sick who were admitted to the hospital, about 2,800 quite healthy people died having tested positive for COVID-19. That's about 0.06. Of the 4.8 million sick people who were admitted to hospital, 94.9% had between 1 and 10 or more than 10 comorbidities. So one can see that it's obvious that we don't have a COVID-19 problem. We have a Western diet problem. So if we treated people early at home and they stopped eating lectin, gluten-rich food diet, many hospitals and pharmaceutical companies would actually have to close through lack of people going there. Okay, so now we're going to have a look at the other comorbidities that these people had. The leading comorbidities for COVID-19 match perfectly with the diseases or the symptoms of a bad diet. It's a Western diet, basically. All comorbidities for all COVID-19 are also as a result of bad diet. That being the case, why are the governments mandating vaccines for a diet-related problem? So all these comorbidities here, this was the most common, essential hypertension, 272,591 people, about 50% of them had that disorder. Disorders of the lipid metabolism, which is also caused by diet. Obesity is caused by diet. Diabetes with complications caused by diet. Coronary atherosclerosis and other heart diseases, these are caused by diet. Esophageal disorders, diet. Chronic kidney disease is diet. Anxiety, fear related, as we saw earlier, that this is part of the gut microbiome, and on we go. Thyroid disorders, depressive disorders, and every one of these things can be linked to the Western diet, eating gluten and lectins. Okay, some more data analysis. So on this slide here, I've used a number of the Worldometer and a few other places to get some data, and I'm saying that this is obesity percentage versus COVID Delta deaths per million population. Now, again, there is no data for these, the causes of deaths. These are the deaths that were attributed to COVID and entered into the Worldometer to get the figures for various countries around the world. And just quickly over to the right here, what we see, we'll have a look at these things in a little bit, but we see that above 20% obesity in a country and a low health score, this is the ranking of the health systems, is the worst outcome. You can see these countries, Peru, Hungary, Bosnia, Gibraltar, Montenegro, etc. They all have relatively low health system scores and obesity above 20%. And just look at these deaths per million. Nearly 6,000 in Peru, 3,000, and these are ranked in order. Okay, and we have a look at Bulgaria, which had a reasonably good health score, but much higher obesity. And they are up around 2,827 deaths per million of population. And as we go down, we see some things that stick out. 60%. In Chechnya, this is the most unhealthy country in the world. I couldn't get their health system score, but relatively high obesity and high numbers. 60% obesity in Slovakia, 30% in Paraguay. All these are very high numbers. I'm going to move at the moment I can't see the figures down below because my camera is in front of them, so I'll just switch over here and I'll move that camera view later. But we get to the other end of the scale as the obesity goes down. I included New Zealand in this because what we see here is New Zealand is an island nation, which is basically closed. We have a good health system, but our obesity is at 31%. This is very high. And we have deaths per million, 5 on the latest Worldometer figures, but very low, also very low test numbers compared to most of the other countries in the world. I wasn't even going to put that on there because it really skews the data, but it's interesting to compare it. Now, when we look at some of these other areas, Vietnam has the lowest obesity, right? So they're down around 153 deaths per million, very poor health system. The worst health system in the world is Bangladesh, but with only 3% obesity rate, low numbers. India, again, they've got a better health score, but low obesity figures, low numbers. Look at Japan there, very high health score, low obesity figures, low numbers. And something's going on there in China. I think that's low test data we can see there. But again, low obesity, very, very low numbers. So saying before, above 20% obesity and low health scores are the worst outcome. Under 20% obesity and good health care, you have a better outcome. And then we saw down below that doesn't matter what your health score is. If you have low obesity, that's almost the best outcome. But the best outcome of all are low testing and closing your country. Now, this isn't worth it because with high obesity, death's going to come eventually. You have to improve the diet. You cannot keep your country closed. This is not going to work for New Zealand. They need to move away from this strategy. Okay, so to close, if we just go through these 5 points, your diet is the most important way to control your health. No matter where you live, your diet should not be high in lectins. Countries with low obesity have low lectin diets and so low COVID deaths. If you're obese, it is incorrect to think that you will be spared colds or flus by having a vaccine. You may be spared contracting the one that the flu the flu that the vaccine is developed for. That's all. And its efficacy will be limited. You will also not be spared colds or flus if you have a lectin-free diet. But you will not be obese, and as the data clearly shows, that the less obesity, the death rate from flu drops markedly, and you will live a much healthier life. So hopefully this presentation has been useful for you, that you've learned something, and please share it, because I'm sure that the data in this presentation shows that if you have a healthier diet, you will live a much healthier life. And if we can do that for our friends and family, well, then that's a fantastic outcome, I think. Again, thank you very much.